a very interesting and diverse group of two kinds of people. One were people who were working in school gardens or nutrition or phys ed programs or nature education that are actually in the schools. The other strand are people who really are in public health or in healthcare, like pediatricians and folks who do public policy here at GW, for instance. And they're in a separate vein, and neither of those veins have met before. So it was a nice mashup.
The programs that were discussed today, there were gardens and nature programs and mindfulness, and everybody was very interested in evaluating the programs and the beneficial aspects of the programs, which is important to pay attention to. It also seemed like there were opportunities for the programs to be standalone, or ideally speaking, complement each other by being integrated as well. It was really inspiring.
Well, I think an event like this is creating a sense of strength in numbers, and also a lot of times where people are doing things individually in their jobs or in their programs, and sometimes it's easy to think, oh, this is very isolated and not, the mainstream doesn't really understand what I'm trying to do, and I'm not getting anywhere with this, kind of I'm spinning my wheels. But when you come to an event like this, you get that kind of feedback that, oh yeah, I understand totally what you're doing.
I think it's always great to be around folks that are talking the same language, that have the same passion and are just as eager to kind of push the needle. And it's encouraging to recognize and realize that we're not out here doing this work alone.
The problem that I saw that could use their combined expertise is the projections for the population of the Americans' health profile in about 20 years, which says there'll be 50% of adults will have some form of chronic illness like diabetes. My question was to myself when I first came upon some of these data points was, whose job is it to make sure this doesn't happen?
We really need to look at what's missing from our education system, because we see that these things are possible, these programs are possible, impact is possible. However, I think the question is now, on a larger scale, what do we do to change the system?
I think that there's definitely an opportunity to provide resources for other communities or schools that may want to learn from people who've done these kinds of programs, these integrative approaches before, and not have to reinvent the wheel. I think that's certainly an opportunity.
There's the whole question is, how do we have this radiate out into more schools and have it be considered kind of the standard for how schools should operate in terms of making the wellness, the health and well-being of the child kind of the focus, instead of it being something that maybe is in an after-school program or it's an afterthought. So I think everybody's kind of on the same page in that sense, which makes it exciting. Even though we're coming at it from all these different angles, I think there's an awful lot of consensus here about what needs to happen with schools.
I think we talked a lot about like these things happening in isolated pockets, and the need for us to communicate more, not about it's just happening, but how do we really come together and have a collective impact.
I'm much more convinced that need is real, and so were many of the attendees, if not all of them. I think one of the primary outcomes that we were looking for was an agreement among the attendees that this is something that needs to be looked at, needs to be explored and considered, and we'll do better if we're together in that process.
I mean, I guess I really do think that there's the opportunity to identify synergies among these different approaches. That would be the ideal, and to try and figure out how we might be able to facilitate implementation and sort of uptake of integrated approaches.
The people who attended were almost uniformly in agreement that, number one, this is a valuable approach, and that what would be good to work together in the next step, whatever that happens to be.